Assalamu alaikum. Dr. Husseinbuxkolachi YouTube is with you, and today we are continuing to discuss the West Asia war. That is basically a war between USA, Israel, and Iran, and the Gulf countries are also uh, part of this difficulty or this war situation. And this is the 13th day, and the supreme leader of the Iran was killed as a result of this war, and many family members. The son, Mujtaba Khamenei, son of a supreme leader, Ali Khamenei, has taken over the India, and now the center of the war is India, but particularly the Strait of Hormuz, and the Al-Aqsa Mosque is also in limelight that it has been closed for the prayers. So escalation of the war is going on, but there is a lot of confusion as well as a changing stance of the American Navy as well as the President Trump that I have finished all the uh, army power as well as navy power and even the nuclear proliferation or nuclear bomb uranium reserves. So this is the situation where Iran is there. But one of the media important people they are saying that in America has no clue where the uranium enrichment process is going on or where it is lying. So that is the main reason, and even the economic prices, the shocks are observed in India, Pakistan, and many other countries. Tourism has been at halt, and even the drug supply and other things are there. So, in that background, we will discuss the moral as well as the situation of the medical in the Iran. Let us start with the Iran's healthcare resilience, navigating crisis. So, as it is Ramadan and the prayer is very near, so these are the contents. You can see that these are the 8 contents, and now you can see that introduction to the escalating crisis. This is the situation where the war is escalating, not reducing, and it has been converted into the land mines, ocean mines, as well as the drone and other attacks. So let us move further. Purpose and the scope of presentation is to analyze the situation and area of focus targets of. So let us move further uh, to that presentation. The stalled humanitarian aid is one of the problem. Blockade of the aid and impact of the critical resources. The impact of the blockade is severe, leading to delayed aid and compounded challenges regarding resource accessibility and immediate availability. So let us see what is the continued commitment under duress, extended shifts despite the self continue to work extended shifts. This is the situation of the medical or patients may be prioritized. Patient safety uh, in a dangerous environment is important. So, 7 health workers have been killed or injured in the strike, and escalating risk of other things is also going on. Uh, so let us move further. You can see that the local resources mobilization, rapid infrastructure repair is required, and internal resource management is going on. This is particularly with the equipment in hospitals to keep the hospital functional, and the structure elements are also required. The hospitals rely on existing internal resources, rationing equipment, uh, and rescuing and limiting. Uh, specific medicines or material to extend uh, utility so that they can do that things. So this is leveraging prior experience. They have experience of the Iraq-Iran war and pharmaceutical production, establishing and purchasing framework because of the embargo and ban. They have a local manufacturing capacity. Uh, Shadow networks means the hidden networks are also supplying the medicine. That is important. You know that the underworld is not only in the crime but in the medicine also. So shadow network is actually the lifeline that Iran healthcare system is sustaining. Then the part two is analysis key finding. Let us see what are these things. One is adaptive capacity, strength of the healthcare system, highlights adaptability and resource shortages. And then is the dedication of the personnel. The dedication and commitment of the health workforce is, I think, at the height, and that is shown with the resilience that no cry and nothing is coming out of from the medical fraternity. Weaknesses and vulnerabilities, supply chain is fragile, and infrastructure vulnerability is also there. So we are just ending our presentation with two, three more slides. Supply chain, diversifying sources, and building local capacity is the main important aspect. Protecting healthcare facilities, security measures are there, and infrastructure reinforcement is there. Even the doctors and nurses, they are repairing the windows, doors if they are damaged, so that the hospital can be kept functional. So I think that is the great lesson we can learn. This the other countries can. Mental health support is important, and another is incentivizing the safety. So these are the important area where uh, uh, daily attention is required. So with this, I think we are uh, collaborating call to action, collaborative efforts, and focus on sustainability because war is lingering on and the new arsenals and new weapons are being used. And now entire weaponology is a full science that is used here. So international and local aid is vital to help the healthcare in Iran cope with missile strikes. Investment into healthcare can safeguard Iranian long-term safety and well-being, which helps them stand strong. So with this, I am thanking and thank you very much for listening this. Why we are using this format because health and public health is a forgotten area or frontier. So we are regularly making our videos to update and to apprise you with the latest situation and to encourage that the medical and healthcare system of Iran is intact, and that is one of the strength. And that was in one of my video that emergency care is one of the strongest in all wars of the world. In First World War, Second World War, and even Iraq-Iran war, the Iran stands out in emergency and wartime healthcare services. The doctors have learned, even they are making their heaters from the wood, and they are using the local knowledge to deal with the emergencies, as well as local resources are also observed and collected by the doctors, and morale of the doctors is also high, and even their martyrs, their families, their countries at risk. but the healthcare services are going on, they are functional, they are being damaged and repaired immediately at a local level. So that shows that when the nation is united, the healthcare is functional, then you can sustain the wars and any kind of disasters, even if the nuclear and other weapons are used. I think the doctors will not be away from the people and their life and people's life, their care will be outstanding in the world history. Thank you very much, Dr. Hussainbuxkolachi. YouTube channel is with you. Please like it, share it. Thank you very much. We are ending our meeting. And with this, I think the Iran deserves and doctors, they deserve a full support from the WHO, Red Cross, International Red Cross, as well as the Doctors Without Borders or MSM, and even the World Medical Association and other organizations, they should support because the health is not a political thing, it should be saved, and whatever the matter is that can be decided by the peaceful means. Thank you very much. Thank you. Khuda Hafiz.